Why are health insurance rates so sky high? Hello, I'm Kevin Canals, an independent health insurance agent in California and also a certified Covered California agent, and I help individuals and families enroll into health insurance. And lately, since the subsidies for the Affordable Care Act through Covered California have been sliced down, people are having to pay the full premium amount for health insurance, and they're like, wow, these rates are sky high. What is going on? So as an agent, from my perspective, having been in the industry for many, many years, I see two big drivers or parts of why health insurance is so expensive. One is the expanded comprehensive covered benefits of the health insurance plans, and the other is just the cost of delivering health care and the prescription drugs. So let's look at the plans, the ACA plans that you're going to be getting through Covered California and off exchange through any of the carriers are going to just have a menu list of covered benefits that we didn't necessarily always see before the ACA came along. Various services, preventive services are zero cost. Routine primary care is covered. Specialist care, the cardiologist, dermatologist, podiatrist, diagnostic and laboratory tests, imaging, x-rays, MRI, CT scans are covered, emergency and urgent care centers, voluntary outpatient procedures, maternity, mental health services, substance abuse treatment, cancer treatment, durable medical equipment, and prescription medications are all covered. And let me tell you, before the ACA, there were plans that didn't cover all of these. And I would invariably get a call from someone saying, I have a plan, I'm pregnant, now what? My plan doesn't cover maternity coverage.
Hang on, we're almost to the room.
Oh boy, this is really it. You are doing great, just breathe.
All right, let's get ready.
And yes, the health plan's rates can be less expensive if you removed maternity coverage. And then there are a lot of guys that, Jay, I'm not going to get pregnant. Why should I have to pay for maternity coverage? Well, maybe you're half of the equation. And sometimes it's kind of nice that if your partner does become pregnant with your child, that there is some coverage there. But I'm not arguing about that. I'm saying maternity is in the plans, and that does increase the health insurance rates. Mental health coverage oftentimes was not included in it's real important. Maybe it's just the nature of my clients, but the mental health coverage has been very important and has helped keep people sustainable and productive in life, and that is so important. But we pay for it. But if you have a family member with mental health challenges and they're able to get help through the health insurance, that can be a big win. Another portion of these covered benefits, the prescription drugs, prescription medications are really expensive. 50 years ago, not so much, but we have the whole pharmaceutical industry has grown, and we have a lot of drugs that are very expensive that people need. It has been estimated that 15 to 25% of our premiums go to prescription drugs you pick up at a retail pharmacy. Sometimes the drugs are administered in a doctor's office, but that's how much. Sometimes it's more than, hospital services. It's very expensive, and a lot of plans didn't cover that, and we never know who's going to need these. And just remember, all these covered benefits, it doesn't make a difference, if you are male, female, young, old, it's all the same for everyone to keep us all healthy in the community. The next large input is the cost of delivering healthcare services to individuals. And it is not cheap. We're talking about the wages for nurses, the administration staff, those nice people who check you in at the office of your doctor or the hospital, the support staff. Those have to be considered and covered within the facility. Reimbursement rates for doctors. Hospital, the physical plant. Hospitals are incredibly expensive to build and maintain. They are just a very unique structure. And the hospitals have to float bonds, they have to pay interest. They are not cheap. And that is part of the cost of the care and the health insurance rates in delivering healthcare services to you. Diagnostic and therapeutic equipment. I had a colonoscopy recently, and I had 2 different nurses in the beginning prepping me. Of course, there was the anesthesiologist, and then the doctor. He seemed to have an assistant. There was the post-op staff after I woke up from the procedure. And, although it was a very short, there was a lot of people involved, and they were highly trained. And my insurance helped pay their wages. And of course, the high technology imaging is very expensive. These MRI and CT scan machines, it's just, they're a lot more expensive than your car, or your EV out on the road. And for the facilities to have those in the communities, it is an expense, and they need to recoup that somehow. And the primary purpose or the primary way of doing that is when they use the machine and they bill the health insurance companies. And that's what happens. See, the health plans contract with the providers. Blue Shield, Blue Cross, Health Net, Molina, Kaiser Permanente contract with the hospitals and the medical groups, the therapists, all of those folks, and the pharmacy benefit managers for the prescription drugs. They contract with them all, and they negotiate rates in many instances. But they must contract with those providers to deliver the care, and sometimes they're paying more for the exact same service from one medical group than they are from another medical group or hospital, because these negotiations are kind of secret. But the exact same service can be different in different locations, and that also reflects itself in the rates. And it's tricky, but we just have to remember that the health plans, they have to include those doctors and hospitals which they can make a contract with. But we can see how the cost of healthcare can change based on where you live, and it must be the cost of healthcare. So let's look at a 40-year-old man, no subsidy, or woman, no subsidy. Southern California, bronze PPO, $635.65 a month for the Blue Shield. Same individual, 40 years old, no subsidy, moves to Northern California, bronze, 60 PPO, no subsidy, $790.48. That's a $154 difference. Exact same covered benefits. Different providers. Healthcare in Northern California is more expensive. There's reasons for that. I'm not going to get into it. It just is. It has nothing to do necessarily with people in Northern California being sicker and having a higher utilization of healthcare services, because we're talking Southern California. That part isn't it. It's the cost of healthcare, and you see it in the rates. But those plans have the exact same copay and the same exact maximum out of pocket. So The rates are high. Everyone says, oh, greedy CEOs, they're getting their money, spending it on who knows what. We're getting ripped off. I'm not going to argue. There's probably definitely some ways. People probably making too much money, not us. However, I do want to point out that within the Affordable Care Act, there is the medical loss ratio. And what that states is for individual and family plans, the health plan must spend 80% of the healthcare premium dollars they collect on healthcare services and quality improvements. 80%. 80 cents of every dollar they collect in premiums must be spent on healthcare, meaning paying for claims that your neighbors and you submit to the health plan. And if they don't, they have to do a rebate back to their plan members. And I've seen it. And they are meeting that 80% challenge. But what about the 20%? Where's that going, Kevin? Well, there is administrative services for these health plans. I mean, you need to have people. Operations, we have computer systems. They're always developing new stuff for security purposes. Marketing, I don't know how big of a chunk marketing is, but within 20% marketing is part of the cost. I am marketing. Agents are marketing. I am paid a monthly fee when I enroll someone into a health plan for Blue Cross Blue Shield, Molina, Chinese Community Health Plan, Kaiser. I'm paid. So I'm part of the 20%. I would like to believe I bring value to the table. Maybe some people don't think so. Maybe I need to be cut out. But what is the overall value proposition for the health insurance is that if you are in one of those freak accidents or something just befalls you, in this particular instance, you are rushed to surgery in the emergency room. You have a two-night stay. The estimated average cost of a situation like that, a healthcare situation like that, $20,000 to $50,000. That's a negotiated rate. That's not the MSRP manufactured inflated list price of the hospital. That's the negotiated rate for the health plans, $20,000 to $50,000. Your maximum liability with a Bronze 60 plan is $9,800. That's the asset protection. So for some people, the Bronze plan, they may have a $100,000 bill, but their maximum is $9,800. If you want to lower the cost of health insurance, you can raise that maximum out of pocket to $20,000 or $50,000. But can you afford that? Maybe $9,800 is too high, maybe it's too low. I'm just saying that is part of the overall determination of the rates for the health insurance. And $90, but again, in network, and all you have to pay is $9,800 for emergency surgery and a two-night stay. Not too bad. But from this agent's perspective, that is what is the two main components for the very high rates of health insurance. The coverage benefits, everything virtually is very comprehensive. You're not going to have a hole in your coverage, your health plans, if something comes down. So the health plans are covering a lot, and they just don't know. Who knows what's going to happen to you or your neighbor? And the cost of delivering the health care. Doctors aren't cheap. Nurses aren't cheap. And I'm not going to ask them to take a pay cut. Do you have any questions or comments? You may leave those down below. I'll do my best to read them and answer them. Otherwise, for InsureMeKevin.com, I'm Kevin Knaus.